Hello and welcome to another episode of Low Tech Health. Let ourselves translate expert knowledge. Today we're talking about perception on Meatless, Eatless Mental Mushroom Monday. We're talking about perception in the hospital industry and healthcare in general. I have this idea that maybe before any of us work in the hospital, it'd do us well to be admitted for, greater than 3 midnights. See what happens. To be on the other side, looking up from that little bed that we try to keep from being the deathbed. Because we don't take it quite nearly as dearly to heart. And I think that's something I've noticed the talk on some web boards of residents who don't understand why NPs are sought more just because they spend more time with patients. Like, it does, the perception of the patient isn't relying off of the level of skill and the strength in their handling their illness, but how much they take away how they felt, how well they understood it. Like, there are different qualifiers than just level of quality care, and it's the perception that because you're not talking to me, you're not caring for me, and that is slippery. And I don't know where the middle ground is, but definitely there's a misunderstanding that physicians have with the idea that who cares if a doctor doesn't talk to you more if they provide better care? Who cares if they don't talk to you at all? It's not their job to talk to you. It's their job to care for you. But that is something that it's not going to get through to the public because they very much needing entertainment. They are needing education. And it's huge because we don't want them coming right back to the hospital. But if they're not, entertained and educated, because damn, if you gotta sell every intervention to a patient who's a level of a knowledgeable level. There's a certain smart person that is just hard to teach and train because they know it all. They've learned it. They can double check anything you've said, and they can re-steer whatever conversation back to whatever echo chamber they're stuck in. Like, if they have a confirmation bias, they're going to keep following it, and you can't break them out of that very well. If they believe that antibiotics are not great and don't need to be the first option, then they're going to try to talk you out of it every single time. Even if they're septic and they're dying, they need to be brought down a peg or two. And perception of them is that they can't be helped, they can't be fixed, they can't be re-educated, and they can't be reconditioned to just listen to the pros. And that's, I don't know if it's the average, but it's definitely where most people think they're the average, because they can Google, they can use their little fingers, and they can look up stuff on WebMD and feel educated enough to debate, and they're just not there. And public does need to raise their literacy level, and I don't know if it's the doctor's job, like they're saying, to just sit and talk with you if they're also trying to provide a higher level of care. So we as Americans need to decide a public program to raise literacy or stop treating emergencies for dumbasses. All right, I'm going to wrap it at 4. Love you guys. I'll talk to you tomorrow on this Talk Culture on Taco Tuesdays to continue. It's just day 1. Of perception of the healthcare industry.